go ahead and transition to the University of Kentucky. Are you guys ready?
We are ready. Can you see our screen?
Yes, sir.
Perfect.
We can see your screen and we can hear you loud and clear. Thank you for being here, and the floor is yours.
Good deal. Well, first off, thank you, PM&R Scholars, for giving us this platform. I know we are honored to be with 3 other great programs tonight so that we can tell you kind of what we're all about here at the University of Kentucky. So what are we going to talk about is always the first question. So who's going to talk to you? So I'm Nick. I am one of the chief residents. I'm the academic chief resident, a current PGY 4. We also have our program director and one of our PGY 3s. I'm going to let them introduce themselves real quick. Nate.
Hey everybody, I'm Nathan. I'm one of the PGY 3s. I'm originally from Los Angeles. I went to medical school at Ross, and I'm a PGY 3 now.
Dr. Key.
Hey everyone, can you hear me okay?
You're good.
All right, I'm Jamie Key. I'm the PD at UK. Took over this role this summer. I was the APD before that. It is really, really awesome to see all of the familiar names on the list from our Wildcat Wednesdays. So what's up to what we call our local fam now. But I went to med school in Pikeville. I'm from the University of Tennessee. Go Vols, right, Taylor? Even though I bleed slightly blue, it's mostly orange. So if you're an outsider, it's okay to come on in and not join the Wildcats.
So if you guys have questions throughout the sessions, we're kind of going to be alternating. So feel free to ask questions in the chat. And then we also have our Twitter handles and our emails on here. We are all on Twitter and we have our emails there as well. So please reach out to us if you have questions. So this is us. This is our group picture that we took last year. Our one this year had to be postponed because of coronavirus, but we'll get one here eventually. So what are we going to talk about tonight? So we're going to first talk about our program leadership. Then we're going to go into some of the basics about the program. We're going to talk about resident rotations all the way from PGY 1 through 4. We're going to talk about the hands-on experience and what you actually get to do procedure-wise here at UK. Then we're going to briefly talk about our didactic schedule. Then we're going to talk about our resident wellness and our resident wellness initiatives. And then we're going to talk about what there is to do in Lexington, Kentucky. So here is our program leadership. So on the top left-hand corner is Dr. McDowell. She is our department chair. And right next to her is Dr. Salas. She is our department vice chair. You guys have already met Dr. Key. She is our program director. And Dr. Savoy is our chairperson of the CCC. So the CCC stands for the Clinical Competency Committee. And essentially, it is a committee that meets on a biannual basis and reviews how we're doing as residents, making sure we're meeting our milestones, etc. And then on the bottom, we have the 2 chief residents. So this is me, I'm the academic chief, and we have our other Nick, so we're the PM&R Nicks. He is our administrative chief. So let's talk about a little bit about the program and the nuts and bolts, as I like to call it. So we are a 4-year categorical program. So you do years 1, 2, 3, and 4 here on UK's campus, and we accept 5 residents per year. Some of the things that a lot of things may get missed on, what are the benefits? What do you get as a resident? This is just kind of a brief snippet of some of the benefits broken down by PGY year. So as a first year, you get Bradham and Frontera textbooks. As a PGY 2, you get a laptop or a technology stipend, and then 2 texts that are related to PM&R. So if you have an interest in interventional pain and you want to purchase interventional text, you can use that during your essentially that allotment during your PGY 2 year. PGY 3 year, you get a $600 education stipend. So that can be used for whatever is educational to you. I'm just obviously I finished up PGY 3-year. I used part of my funds on PM&R recap and a board prep program. And so that is what I use part of my money for. Then as a PGY 4, you get a $1,400 lump sum educational stipend. This is predominantly used for either a board review course or to help facilitate your purchase of boards when that time comes. And then also our program has 2 paid conferences. So as a PGY 3, you go to AAP, and as a PGY 4, you go to AAPM&R. This is with or without accepted research. So as a 3 and a 4, you are required to send a case study, a case series, or if you have a randomized controlled trial that you've done, you submit it. And if it gets accepted, awesome, you're going to the conference. If it doesn't get accepted, that's okay. You are still being financially backed by the program to go, just so you get that experience on a national level. Additionally, we have research awards each year. So we have 2 in the fall and 2 in the spring. Essentially, this provides residents the opportunity to go to conferences that may be outside of AAP and AAPM&R with accepted research. So those are also available to us. And then also we get personalized scrubs and or a white coat every year. So for example, if you want 2 pairs of personalized scrubs and a white coat, that is your allotment for the year, and you can switch that up depending on what your needs are. So here are some of the pictures from this past year. So this is from AAPM&R 2019. These are our 4 PGY 4 residents that we had here on the right side of the screen. Right now, John is doing a fellowship in spinal cord injury at Kessler. And then we have Morgan here in the middle and Ruth on the left. Morgan is doing private practice inpatient rehab in Arkansas. And then Ruth is stayed in academic medicine and is at Indiana University doing kind of a compilation of things between EMG, pediatrics, inpatient, outpatient. So we miss them dearly, but we're just very proud of them. And that's yours truly here on the left, testing out some technology at AAPM&R. And then as PGY 3s, we all went to AAP. So these are just some pictures of our faculty and residents at AAP. This is all of us at Don Julio's. As you will come to find and get to know us, we're a big family. And we honestly love hanging out with each other. So let's get to the rotations and what you do as a resident in your experience. So your PGY 1 year is essentially set up as a transitional year. So as you can see, you get 4 months of internal medicine, you get 4 months of surgery, 2 months of neurology, 1 month of outpatient PM&R, and 1 patient of outpatient pediatrics. The reason why it's formatted this way is so that you can get experience and feel comfortable of taking care of any patient when you step onto the rehab unit. So for example, if you do only internal medicine, your PGY 1 year, you'll be playing a little bit of catch up when you get on the general rehab or orthopedic unit, the neurosurgery units, because you're not experienced to the surgical realm. And then the opposite can be said if you do an only surgery intern year, you might be playing catch up on managing some of the medical aspects of patient care. And so I will speak for all of us, all of the residents at the program. It is a tough intern year. There is no ifs, ands, or buts about it, but each of us feel very prepared at the end to take care of any type of patient concern and any type of patient population. And then we also start to get integrated into the PM&R realm through our outpatient clinic, and then we get outpatient peds. We get a month of that as well. Now, our intern year, the majority is at Chandler Hospital. It is a 945-bed acute care hospital. It is a level 1 trauma center. It's a level 1 pediatric trauma center. It's a comprehensive stroke center, and it's part of the National Cancer Institute. One thing that I want to mention is I said that the intern year is difficult, and that's because of how sick our patients are. Chandler is actually #1 in the CMI, so Case Mix Index in the nation. So Case Mix Index essentially tells you how sick your patients are. We have that distinguished honor of being #1 of having the sickest patients. And if they're all at Chandler, they're coming to all of us in rehab. So let's talk about what your rehab experience looks like from an outpatient rotation perspective. As we mentioned, that PGY 1 year, you get your PM&R clinic month. And then you get outpatient experience your 2, 3, and 4 years, PGY 2, 3, and 4 years. And as a PGY 2, you get time and 2 weeks in interventional pain and 2 weeks with sports medicine. The sports medicine is new this year, and that is because we wanted to provide residents with an early exposure to sports medicine in case that was an interest. And so that way you can get integrated into that, into the sports medicine realm, start on your application, get research. And so you have that opportunity early on as a PGY2 to kind of set up your application, because at the end of the day, we want to make sure that you are the most competitive fellowship applicant and or attending when you graduate. And then you also get VA exposure. So we spend time at the Veterans Affairs, and this is a combination of MSK, EMG, TBI, and spinal cord. Then you take a look at our PGY 3 and 4 years. As you progress, it gets a little bit more outpatient heavy, being the 4th year is the most outpatient heavy. This is where we spend 2 months in our PM&R clinic, which is a combination of MSK and neuro rehab. And then we get specific UK EMG, and we go back to the VA as well. And as you see here, you get as a 3 and a 4, you get a month of elective that can be used for outpatient or it can be used inpatient. One of the things I want to mention that makes our schedule a little bit unique is that you get all this outpatient experience as a PGY2. So about 4 months of your PGY2 year, it can be outpatient. And that's because doing a whole year of inpatient can be a little exhausting. And so we want to make sure if you want to be an outpatient provider, you get that experience as a 2, and that you're not playing catch up as a 3. From an inpatient rotation experience, you have it throughout your residency. So as a 2, a 3, and a 4. During your PGY2 year, you're spending 2 to 3 months on 3 different services. Stroke rehab, brain injury, and our complex medical. So this is where our transplant, dialysis, some of our very sick patient COPD exacerbations, those are the type of patients that you are taking care of here. As a PGY3, you do 2 to 3 months on spinal cord, and then our general or orthopedic service. And then you're also doing a month of PM&R consults, which is over at Chandler that we talked about. As a PGY4, you also get a month of inpatient rehab just to refine those skills if that's what you want to do with your career. And then you get 2 to 3 months of UK consults. So where is our inpatient rehab done? It is a place, we call it the Hill, Cardinal Hill Rehab Hospital. It is a 232 standalone rehab facility. We also have our outpatient therapy, our clinics, and 2 therapeutic aquatic pools in this facility. Within Cardinal Hill, there are a total of 6 acute rehab units. So we have 2 stroke units, a brain unit, a med unit, the general rehab, and spinal cord. One thing that is awesome and what allows us to be efficient and has a very strong educational value of it is while you are on your brain injury month, those are the only patients that you are taking care of are brain injury patients. And so that way you can really hone your skills, you can learn about that population, and that same can be said about all of our rotations because you have the distinguished units. We also have different pieces of technology that our patients use, Locomat, Geosystem, and the FES bikes, and then some Bioness integrated therapy as well. Now, we mentioned electives. What can you do with your elective time that you get as a 3 and a 4? Well, pretty much you can do whatever you want. These are the options that you have available to you, but you can essentially be as creative as you want with this. So for example, I'm currently on an elective doing 2 weeks of brain injury followed by 2 weeks of research. And so you can kind of mix and match. You can have a dedicated spasticity elective, filling baclofen pumps, doing Botox injections, and managing outpatient spasticity. And we also have this administrative or leadership elective where you can essentially spend time with different individuals and administration in the hospital if that is something that you would like to do. So those are the options, some of the options we have for electives. Now, one of the
Hey,
big
Nick,
questions.
I'm sorry to interrupt.
Yeah.
Just want to give you a 5-minute warning.
Okay, thank you. So one of the questions is what is our hands-on experience? And so this is where we are at from a numbers perspective. If you take a look in the far right-hand corner, we are in the 90th percentile for hands-on exposure. So we are getting a lot of injections, a lot of procedures during our time. Now you may kind of make mention of, well, what about trigger points and EMGs? You're a little bit lower in comparison. And quite honestly, that's because people quit documenting. They got their minimum of 5 for a trigger point and their minimum of 200 for EMGs, and they just stopped logging them. And so I expect those to be much higher this next year because that is not representative of our experience. But at the end of the day, you're getting a ton of hands-on exposure. Next, taking a look at our didactic. So it occurs every Tuesday and Friday from 7 a.m. to 9. It is completely protected, so our attendings take our pagers so that we can focus on the lecture. Some of the features are our chief round schedule, which is a combination of resident lectures and also our virtual grand rounds. Some of the speakers we have this year are Dr. Silver from Harvard, Dr. Mottner at Emory, Dr. Che from Case Western. We're bringing speakers from outside of the department to give us a grand rounds presentation. And then we also have a specific SAE review course. So with that, I'm going to turn it over to Dr. Key to talk about our wellness initiatives, as I know this is near and dear to her heart.
Yeah, with that 1 minute we have left, we'll talk about this. So in the last couple of years, we've developed a pretty formal wellness committee at the University of Kentucky. We touch on every single element that you see listed on the screen. And we have a committee that literally just sits down and breaks down what each of these mean to us and where we can improve in all of the areas. Go ahead and go forward, Nick. Shameless plug, we just added a new member to our PM&R family, which is the UK PM&R Peloton. We're going to have a competition via Twitter on who gets to name it because we haven't yet. More to come on that. Next. We like to hang out with each other quite a bit, and I hear you, Cynthia. We do quite a bit together. The residents get 2 team building retreats per year. This is some of these pictures are from that. Some of this is just when we all get together. I know that there's formal dinners that we'll establish. One of these pictures right here is a chili cook-off at my house. The other one is a team building exercise that the residents did where they went to this indoor climbing gym. But if you ask any resident or myself, if you ask them about any random week in the year, we're probably getting together once or twice a week with social distancing lately. But we do love each other. We're a great big family. Wellness should be synonymous with UK PM&R at this point because it is our most focused endeavor. I will just say, since we have no time left, that if you are truly interested in what we have to offer and want to meet us more, please come to our Wildcat Wednesdays moving forward. Otherwise, I'll give it up to Nate so he can talk to you guys.
I'm just going to quickly mention how good it is to live here in Lexington. I'm a West Coast kid my whole life. I always lived by a beach, so coming to Lexington, I was a little apprehensive. But the city's great. It's extremely affordable. It's the perfect size for residency. It's not too big. It's not too small. It's super safe. I live here with my new wife and my dog, and we walk our dogs. We have our doors unlocked. It's a great city. It's horse and bourbon country for sure. So if you like either one of those two things, you'll love it here. And if you don't, you'll learn to love them. Go ahead, next slide, Nick. So some of the fun things we have to do here is Keelan. Keelan is one of my favorite things to do every year whenever we have it. Hopefully COVID goes away soon. It's a big horse racing event, but it's more than that. It's a big get together for the whole city. There's horse parks in the morning if you have kids and you want to bring them to meet the horses. If you're into having a few bourbons and hanging out and kind of enjoying the sunshine, you can do that as well. If you want to go to a kind of a bigger event, there is the Kentucky Derby, which is only about an hour and a half drive away. So that's not too far either. Some things that we can do with horses and physical medicine and rehab is we do hippotherapy, which is a great way to get kids involved with horses. It builds their strength, it builds their balance, helps them with coordination. It's a really great, unique thing that we do here in Kentucky, in Lexington specifically. And if you want to get involved with that, it's a great opportunity here. So we also have great outdoors.
Nate, I'm so sorry to interrupt, but our time is over.
Oh no.
Well, you guys can take a look at those beautiful pictures.
Yes.
If you're interested, come join us on Wildcat Wednesday. We get together, talk about the program so that you guys get a chance to get to know us and we get to know you. So make sure you come join us. We'll drop the link to sign up in the chat.
Very good. Thank you so much, Nick,